Welcome to Conversations in Health, Global to Local. We have, tonight's notable for a number of reasons. We have our first alumni of this class. Luisa Ferrari was in the first year we held this class in 2019, we think. So this is a first. Hopefully we can welcome one of you back sometime in the future. That would be my hope. Well, welcome. One of the things we've done differently both this semester and last semester, this is in response to feedback from students in previous classes, is to invite, and this is also a shout out for please suggestions at the end of the year, please fill out your evaluations. But one of the suggestions was that instead of typically, because I'm old, I tend to know people who can come and be your speakers who are later in their careers. There's a desire, and I think it worked out really well last semester. I'm really excited Luisa's here to have somebody who's had a health career that's been very interesting, though much shorter than some of the last couple speakers that you've had. So I think it's a chance, especially for those of you who are, Luisa's closer to where you are in terms of the kinds of decisions that you're trying to make about how to craft your way forward, and so I'm hopeful that this will be a little bit different, but also really enlightening. So Luisa, welcome.
Thank you.
Welcome back. This is fun.
I'm so excited.
I know. I also realized I hadn't seen you in person in a long time. So it's anyway.
A lot of Zoom calls.
Exactly. Well, it's great to see you. So thank you for joining us. As you know, because you've been in this class, we always start at the beginning. So I'd like you to tell us a little bit about where you grew up, your family, and kind of a little bit about your path before you came to Georgetown.
Yes, so I'm actually also from North Carolina. I'm from Durham, which, for context for folks that don't know Durham, it's really the research triangle hub is what we call it. I think it's the highest concentration of PhDs in the country, which is pretty crazy. But along that theme, both of my parents are physicians. So my mom is a pediatrician and my dad does HIV research. And then I have one younger brother who's also in DC now. So I spent my entire childhood there. I think it definitely shaped a lot of my interest areas. We did a lot of traveling because my dad did HIV work in Tanzania. We spent a couple summers there growing up. And yeah, that's where it all started.
Was he affiliated with one of the universities?
Yes, they both work for Duke. They've had the same job their entire lives, so I've already doubled them in different jobs, but they're both, Duke-based.
And did you go to public high school, private?
I went to a private school called Durham Academy, so it was a smaller, there were only 100 kids a grade.
Oh, wow, okay.
Yeah.
And all the way through?
All the way through K through 12.
Wow.
It's a very, you're there when you're in Durham. You're really rooted in where you're from.
So you've only, in terms of education, you've only been to Durham Academy in Georgetown.
That is correct. Well, in 1 year.
Okay, fair enough. Okay. All right. Well, that's good. But tell me a little bit. It seems like some of the experiences you might have had in the summers in Tanzania might have influenced some of your thinking about coming here to study global health.
Yes, definitely. So I think having two parents in healthcare, it makes you really passionate about helping other people because you get to see the people you love doing something they love, which helps others. But I do think it also shaped, when I came to Georgetown, the only way I thought you could do healthcare was by being a doctor. So for those of you who are there pre-med, I was there. But I think getting to visit at a young age different countries, and I think we went to Tanzania when I was 8 for a summer, really kind of opens your eyes to the different circumstances in which people live and the different access to healthcare people have. So I think that was something that was instilled in me really young, is I was never able to justify why just because someone was born in a specific place to a certain family, they had access to different levels of healthcare. So that was something I got to see very young. And then they actually did something a little wild. When I was 15, they sent me off by myself. So I spent a whole summer by myself there, which was maybe not something I would suggest if you ever have 15-year-olds to send them to a foreign country unattended.
What did you do while you were unattended?
It was a journey. So I worked at, volunteered at an organization that worked with children in different programming. And then I also worked at a women's health clinic. Worked is a strong word. Sat and learned and did whatever task they had that I could help with. So that was a really interesting experience to sort of see the healthcare system and the different education systems firsthand.
Interesting.
Yeah.
Oh, okay. And so what made you decide, when you're thinking about colleges, I assume you applied to places in addition to Georgetown, but what were you thinking about and what made you interested in Georgetown?
So I actually only applied all the way through to Georgetown.
Wow.
I was committed.
So what made you so interested in coming? It's so unlike almost. How many people here only applied to one college?
Okay.
All right. Maybe there's more than. Maybe it's just I do these interviews for high school seniors, because I'm an alum, and everyone I speak to now applies to like 15 or more schools. So it does seem that's amazing. Well, good for you guys. So what made Georgetown the top of your?
I was very
short list?
sold. So I actually came here on one of my dad's work trips for a vaccine conference. And I knew at that point I wanted to do global health. And I knew I wanted to be somewhere where they had a really strong global health program, which Georgetown at that time was one of the few schools that had like really robust programs. And then I like this idea of still having a campus, but being near a city because of all the opportunities that you have. And turned out to be really a driver for the rest of my career of being in DC that I didn't fully realize at the time, but it was definitely something I was thinking about of there's all these ways you can get engaged when you're in a city. And then one of the things that really sold me is I got to sit on Professor, I'm going to butcher the last name, Vukovic's class, and she was leaving that week to go to Tanzania to visit students in the field. And of course, that's been such a special place for me throughout my life. So it kind of felt like one of those things where it was just the right place and the right fit.
It was meant to be.
Yes.
So when you were here, like everybody else in that class, so I know you majored in global health, but you want to tell us a little bit about your time here and what was most meaningful?
Yes. So I started out in global health in pre-med, and I think one of the things they asked us in our very first pre-med or our very first global health class was how many of you are pre-med, and 75% of the class raised their hands, and the professor goes, by the end, only 25% of you are going to stay on the pre-med track, and I was like a bit flabbergasted. We were all kind of taken aback. Turns out she was 100% correct. And I think that's because during the time here, you learn about so many other ways to be involved in healthcare and public health. So I was on a bit of a journey. I did just about maybe everything you could do on campus. I was in a dance company. There were 2 alumni that had started an HIV testing organization, so I participated in that. I was in Blue and Gray, so I was a tour guide. So I did a lot of walking around backwards on campus and just minimal falling with that. What else? Oh, I volunteered at the hospital. I volunteered with an English language program. I did, what is it called? The college testing tutoring, SAT tutoring.
The DC schools?
I did DC schools, and I did like a separate org SAT tutoring. So
you were busy.
Busy, to say the least.
So I know that a lot of students start in pre-med and then they decide, but it's not for them. And there are lots of ways, obviously. And part of the whole point of this class is that there are multiple ways in which you can contribute to health in addition to being a doctor. But in your personal case, being the daughter of 2 physicians, what was the thinking that you went through that said, I want to take some of these other tracks?
Yeah, so it's
and
definitely,
particularly going to law school, ultimately.
Yes, that was quite the pivot. I think the last time my parents asked me if I was sure I didn't want to go to med school was when I was actively applying to law school 2 years after college, where the ship had really sailed at that point. But I think there was a little part of them that was holding on. So I think where it came down to for me was I was sitting in these biology classes, organic chemistry was a beast, and I realized I wasn't enjoying the class, and I wasn't doing well, I think, not because I couldn't, but because it wasn't like scratching that itch for me. And I realized I was having much more fun engaging and participating in my bioethics class. And so I had taken a pause from pre-med for a semester and was going back to it in the summer, had like one day of like a total breakdown and was like, I can't do this. This is not what I want to do. Called my parents that day, dropped out of the class, and was basically like, oh my God, you have to figure out something else to do with your life. This thing that you thought you were going to do for 19, 18 years is no longer going to be the thing. So I, at the time, had an incredible roommate who was in the SFS, and she said, well, you're in DC, why don't you do an internship on the Hill? And I said, well, I guess I could do that. I mean, I don't know anything about it, but sure, I can throw in some applications. I have nothing else to do this summer now that I've dropped this organic chemistry class. So that is how I first forayed into policy, and then it was all sort of a tumble journey from there.
And who did you intern for on the Hill?
Ooh, so I spent a year on the Hill, which I do think if you're looking just to do it one semester is probably enough, but I started in Senator Casey's office from Pennsylvania, and he just lost his re-election campaign, but I was one of 17 interns, and I was the only intern that had never taken a government class and had zero ties to Pennsylvania. Literally zero. So I had gone down the list of committee members on the healthcare committee and applied basically to whoever, and I guess made a really good pitch about why I was really interested in health policy. And everyone else wanted to do foreign affairs policy, so I think that gave me a little bit of an edge to come in and be.
So what did you, obviously Hill internships, I do encourage everybody, if you are interested, to take advantage of being here in DC. But what was, it seems like that was like a new interest.
That definitely, something about it clicked. And on that, in my first internship, I was on Medicare and Medicaid policy, and a big issue we were working on was around work requirements in the first Trump administration which is like an old point now, but at the time was a lively debate. And so it was interesting to me to see these groups coming in and talking to the staffers and seeing how the staffers incorporated the feedback and then would put it forward into legislative proposals. So starting to see that process go all the way through was super fascinating to me, and I had some really great mentors. And then after Senator Casey's office, I went to Senator Murray's personal office. She's from Washington State, is like the all-star champion of health and women's health on the Hill. I feel incredibly fortunate to have interned with her and got to then build out these health topics a little bit more and started touching on some global health topics there. And then from her office, and I think this is a good lesson, and sometimes you get a no, I had applied for her committee intern position and had been told no, but got the personal office one. And then because I had done a good job at this personal office internship, was able to apply again, have people vouch for me, and was one of 2 undergrads that was able to work on the committee in the summer. And that's when I really covered serious global health topics, helped with hearing prep, and just the swirl and the pace and this feeling of if you're doing policy right, especially on the Hill, your ability to impact so many people, it just clicked. And I love my parents, I love physicians. I think having that one-on-one interaction with patients or helping to create a new medical product is so impactful. But this idea that if you're doing something with good intentions and very thoughtful and working with all the right people and talking to them, you can create this product that all at once can positively impact the lives of so many people, was just something that really clicked for me, and that's when it took off.
And then I can't remember the sequence now. Did you do the WHO practicum and then CDC? How does?
Yes, so that was all my junior year, basically, that I spent the whole year. I worked 20 hours a week my entire junior year, which maybe not the most advisable. I think I had classes one day from 9 a.m. to 10 p.m. To make it all work. But then the global health major at the time, and presumably still now, they have a requirement for you to go abroad. Okay, so a bunch of my friends, and a number of them were still pre-med, a number of them were interested in research, they were all getting placed in these locations where their whole semester was going to be putting together a research proposal and executing it. And that, at this point, sounded like my personal nightmare. So when we sat down to have these conversations with them, I was like, look, I'm pretty sure I want to do this policy thing as a career. Research is not really my biggest interest area. Is there anything that would be a good fit? And the other thing I should mention is I minored in French. And so because I minored in French, they said, we have a partnership with the World Health Organization where they will take some interns from us would you be interested in maybe going to the Brazzaville office in the Republic of the Congo, to the Africa World Headquarters, or Africa Regional Headquarters of the WHO? And I said, great, sign me up. I'm ready to go. It was funny because when they placed me, I think my dad at the time was like, last time I was at Afro, there were bullet holes in the building. And I was like, this is a little dramatic. It's going to be fine. And so that's how I ended up. I think we got our visas 2 days before we were supposed to get on the plane.
Wow.
And then I was in the Congo for 4 months.
What did you do while you were at Afro?
So while at Afro, I was in the health governance and finance group. And I had never touched anything money related before. So it was a bit of a crash course in like financing a program budget. We did some talking points for different meetings. And then probably the most impactful thing they had us do was travel to different conferences that they were putting on. One of the coolest that stuck with me was they did one where they brought the health ministers and finance ministers from countries together, because a lot of times those groups don't work well. So we helped organize and put on this conference and facilitate these different discussions for those groups to talk together, which was super interesting. We helped with another conference in Cameroon, and then the last one, which I don't think we told Georgetown about until we got back, but they sent us to Eritrea.
Really?
Really, for their health development plan mid-sector review.
That's good that you told them afterwards.
Yeah, it was. We didn't know till we got there. There's no cell service in the country, and you could only get money from Western. Like you couldn't use credit card. You couldn't exchange cash. You weren't allowed out of the hotel without supervision. It was quite a journey, but we learned a lot. I think.
No, it was a different place. Yep.
It was definitely. But that was a good experience of seeing the plan that they had put together and getting to talk to them about what had worked, what hadn't. And then part of the review from WHO is to provide recommendations. So you don't want to just come in and tell someone what they should do. You want to hear from them and really do it in a collaborative process. So it was really interesting to hear and learn about how you work with different stakeholders. Okay. And so that's a bit of what I did there.
And then when you came, were you still an undergrad when you started at CDC, when you're working? Because that would have been, what year was that?
That was, 2019 fall into spring of 2020. So gotcha. I was sitting there. You also had to do a spring internship through the major. I was also like, I don't think I want to do what some of the more traditional placements had been. So I got the bright idea to cold email someone in the CDC Washington office. So I'm literally sitting in the Congo being like, hey, I saw that you have this really interesting job. I'd love to learn more about it. Also, do you have any internships with this office? And she emailed me back either that day or the next day and said, yep, we have an internship program and the application's due tomorrow. So I stayed up all night on my WHO Wi-Fi trying to crush out this whole application package to turn in, and then within a couple weeks had been interviewing. And it turned out the woman who was my mentor on the help committee, who's going to be a recurring character in the story, had called the CDC Washington office and said, hey, I know her, she's great, you should bring her on as an intern. I hadn't even told her yet that I was applying. So one of those, like, the people you know reappear in your life. And anyways, was able to get this internship placement. They actually told me at the start that I was going to be mostly working on tobacco policy because I was starting in January 2020. I don't think I worked a day of tobacco policy for like 4 years because COVID just
took over.
Yeah.
So just briefly, what does the CDC Washington office do, and what did you do before you went on as a full-time employee?
So the CDC Washington office, I think sometimes folks don't know about it. I didn't even know that this was a thing that every agency had, I think, until I was there. But it's basically the gateway between CDC and the Hill. The way I like to think of the position in the office is really a facilitator of knowledge translation. So one side of it is taking information that's coming out from the scientists, so reports that they're doing, requests that they have, and helping them structure that in a way that'll appeal to the Hill, and then helping them share that with the Hill. The flip side of that, which and a lot of groups do that, like I think there's a lot of lobbyists that do similar work. One of the things I loved about the CC Washington office is that you also had the reverse, where anytime Congress had a question about what are you doing on that program, why did you make this decision, it would also filter through the CDC Washington office, and then we would work with the experts in whatever the subject area was to craft a response to respond to the Hill. So it does a lot of different functions, everything from hearing prep, submitting testimony, dealing with congressional oversight requests, which I spent a lot of time on. But I think at its core, it's really this facilitator of bridging policy and health expertise.
So you go from graduating from Georgetown to then working at the same office in a regular job.
Yes.
And somewhere along the way, you decided you wanted to go to law school.
Yes, I think after quite a few conversations with you.
Well, why don't you? You can do. I'm sure, as you know, I didn't try to persuade you to go to law school. But,
no.
But what ended up did you end up deciding? Why did you end up deciding that you wanted to go to law school?
So, I think it was a lot of conversations with people who had done it, because I think it's really important, especially before you make the commitment of something as time intensive and financially intensive as law school, to make sure it's something you really want to do and are really going to get something out of. And for me, I think at its core, there was the same sort of appeal that I had of how do you bridge policy and health information. The third sort of triangle for me was the law. And yes, the law and policy are overlapping, but it's more expansive than that. So I was really interested in this bridge of when you're working in the legal space as well as the policy space, similar to how do you create and work within the law in a way that will actually have positive benefits for people on the ground. And I think that's something I heard a lot from my parents growing up of like, man, they put in this new policy or we have to follow this law and it just doesn't make sense with whatever we're actually trying to do in the day-to-day. So this idea of helping to fill that gap between the three was really fascinating to me.
So when you started law school at night, you're still all the way through. So when did you start law school?
So I started 2 years after I graduated, and those 2 years were chaos at CDC. I mean, it was
COVID.
July 2020 to 2022 that I started school. So I was working in crazy hours. I think one of the pieces of with having a lot going on with COVID was I had the opportunity to take on things a lot earlier in my career than you maybe would have. So by the middle of maybe the end of my first year into the second, I was starting to lead our hearing prep process in the Washington office for Dr. Walensky at the time. So I think we did like 13 hearings in a matter of months. So you're just nonstop churning things out. And so in the interim was also applying to law school, had some incredibly supportive supervisors that are mentors today. That I don't think I would have been able to do it if they weren't supportive of me throughout the process. So ultimately started exactly at that 2-year mark.
Okay. And so you managed going to school at night, working during the day, and then your job at CDC ended at some point along the way.
Yes. So I covered quite a few jobs at CDC.
That's right. Yeah, I forgot that you've changed several jobs.
I did a little bit of bouncing around. Within the CDC Washington office, I covered a number of accounts, and happy to talk if any of y'all have questions about them. So I covered everything from the data portfolio, was a big one that I did a huge legislative push on around data authority. I covered the Chronic Disease Center for a period. I covered, it's now called the Public Health Infrastructure Center, but used to be like state tribal health, and then and I did a lot of our oversight work during COVID of responding to inquiries from the Hill about things they were usually not thrilled with us about. And then to the picture of all things come around, my mentor from the HELP committee came back to CDC as the Deputy Director, Chief Strategy and Policy Officer. And she was like, Louisa, you're here. This is great. Why don't you come help me for a period? So I went over as her special assistant, which meant that we were doing all of policy, all of communications, appropriations for the entire agency was filtering up through her. So did some really interesting work around different initiatives that they were rolling out at the time. I got to go to the UN General Assembly meeting with her, which was great. And then, of course, there was a change. I went back to the CDC Washington office, and another all things come around. That woman that I cold emailed in the Congo when I was in college had retired. And so I was able to go back and cover the global health account for the last 9 months, which was really a dream come true. It's my passion area, one of my passion areas. And then this year happened. So the CDC Washington office was included in the October reduction in force decisions. It was ultimately reversed with the budget bill. But around that time, again, the same woman who I was her special assistant, worked around the Hill, was at the Parkinson's Foundation, and she was very kind to have me come on board to help her build up their new policy team.
Which is where you are.
Which is where I am now.
Oh, exactly. And you'll see the readings you all had sort of track different parts of Louise's. Thank you for sharing so many of those. And so now you'll be graduating from law school.
I will.
And very soon, right?
Yes, in
and
May.
And taking the bar this summer.
Hopefully passing the bar this summer too.
And do you want to talk about what you're thinking about doing next?
Yes. So I next fall will be starting at a law firm in DC in their food, drug, and device group, which is going to be the first time I'm really in the private sector. But I am excited for it, and it's going to be a new issue area. I've done CDC work basically up until I've been at the foundation. Now I'm starting to dabble in NIH and FDA, but it'll be still regulatory focused, and maybe, that's the plan.
Well, congratulations.
Thank
Getting
you.
through law school part-time is no small thing. So that's a great, and you're a terrific law firm. So just heads up, I'm now blanking on, so who are our three? Okay, I'm going to start with you guys. So heads up, but before we transition to questions, just maybe one stepping back here, and this is more about how you've been at CDC and you've seen the challenges and the opportunities. I guess before we switch a little bit to the rest of the class, just any reflections you have about where we are now, 12 months into what I think has been the most tumultuous time in the history of the organization.
Yeah. So I'll also preface this by saying my views are my own and don't represent any prior, former, future employer. This year's been really hard. Like, transparently, it's been a tough year. I have a lot of really close friends that were directly impacted. I wrote down some of the stats in case anyone had questions, and I think it was something like over 40% of the different branches or divisions at CDC have been fired at least once at some point this year. Now, a lot of them have been brought back, but just to kind of show you the scope. Another thing from this year that I think will tie into my overall, but I don't know how many of you heard about this, but there was a shooting at CDC in August, and a man shot over 500 bullet rounds into the building, and this is the building I work in when I'm in Atlanta. So when you talk about it being a tough year, I mean, that was tough. And he specifically stated that when they were doing the work around it, it was specifically because of beliefs around vaccine misinformation. So I've had friends that have reached out after they've been fired. I've had friends that have reached out sending me photos of, and I probably should have done a trigger warning, but like actually sending me photos of bullet holes in their windows where they were sitting.
It's extraordinary.
It's been a year. And watching, in the Global Health Center specifically, which I was covering at the time, they lost a third of their division of global HIV and TB staff while I was there. So I think there's also these feelings of, could you have done more? Could you have changed something? So I think there's these really profound feelings of loss. However, I do think, and I also think there is this sense of change is not always bad. And I think sometimes we think, oh, change is just inherently poor and that's not the case. And I know one thing Dr. Cohen talked a lot about when she was leaving was the need to proceed with a scalpel, not a hatchet. And so I do think that has been one of the things that's been challenging is it doesn't always seem like decisions have been thought all the way through. But that being said, I do think there's change creates opportunity of how do you move forward. And I think there's a part of what the community is grappling with of how do you recognize what's happened, process it, but then also work with what's still there, lift up what you can, and think about if there's things that you can do better in the future. So it's been a complicated year. I think there's a lot of complicated pieces around it, but
Well, thank you for working there, and thanks for sharing, because I think this is, whatever the future of the CDC is, or any of our public health agencies have all gone through different changes in the last year. It's just, we're going to need this work, and it's the important work that many of you in this room and on Zoom are going to be doing. So this is, we're at a moment of transition, and so thank you for what you've done.
Yeah, of course.
So Lauren, I think we'll start with you.
Yes, and what you just mentioned leads perfectly into the question that I wanted to ask you is, how do you imagine the CDC rebuilding after this moment? And as per your journey, do you envision a role for yourself in that work of rebuilding?
that is a good question. In terms of myself, I can't predict too far out what will be and what will not. I do think it's important to recognize that any moment you're in is a moment in time, right? Like, things are not going to be like this forever. Things were not how they were before forever. There will be a future, and hopefully you all will be a part of that in some way if you want to. But I do think it is going to be this unique opportunity of thinking through. There's going to be some things that I do think will need to come back that have been changed. But I think it'll be also a time to think through, are there things that should be reorganized in a way that makes sense? One of the biggest sort of gaps for me is I think there's been a really large brain drain. So I think it's going to be a matter of how do you get, and even when I was at CDC, I think it was something like less than 10% of the staff were under 30. And a lot of the younger folks were the first to be let go because they were in their probationary period in government. So it's how do you rebuild the skill sets? I think it's going to take time, and I think it'll be a product of the moment of where we are too, right? Like, COVID shaped a lot of the work and priorities, and I think at whatever point there's going to be interest in reshaping, it's going to be a product of the moment. I don't know if that quite touches on it.
Thank you.
Rebecca?
Yeah, you talked a lot about how you were very involved in so many activities at Georgetown. I was just kind of interested in what skills or like advice would you say that really helped you transition from like being a student to contributing like meaningfully in either the professional policy environment?
That's a good one too. I think maybe one thing for sure is being able to work with different people with different perspectives, especially in this field. Being able to know whatever you're trying to achieve and talk about it in a way that resonates with whoever you're working with is something that I think you learn when you're doing different activities with different groups. I think another one is time management, and how do you use your time? You have a finite amount of time, and you also want to live your life. So how do you balance it in a way that's going to be most productive? And then lastly is, and I think this is undervalued sometimes, it's just being a person that people want to work with, and being able to operate in spaces with different types of people. How are you responsive? How do you take the time to think about if there's conflict, what's actually driving it? How can you address it? So I think those are all like some of those interpersonal skills that you gain while doing different activities.
It's interesting, right? Isabel?
Yeah, thank you so much for speaking with us. I think kind of your end point when you were talking about change, or you have a very holistic kind of view on how things have gone the past year, and so it's really wonderful to kind of hear you speak about all of that. In class, we've had a number of people who have come in, and a lot of times they talk about like their North Star, guiding principles or values. I guess what do you see as your North Star, guiding principles when it comes to your work or career, and has going to law school kind of strengthened or changed these values, and as you're hoping to like make an impact?
Yeah, so I went back for this class and looked at the final paper that I wrote.
Oh my gosh.
Which was quite the experience. And I don't know if this will still be allowed, so maybe don't copy it before checking with Professor Monahan.
I'm fascinated to see what you wrote.
Well, what I did, which I'm going to kind of steal from someone else, is what I did for my final paper was wrote down my favorite quotes from the class and reflected on them. And I think I went back and looked and pulled out the ones that actually resonated with me the most. So I'll attribute those to what they have. But one of the first, and this was actually from Dr. Fauci, they went in order of who we spoke to, but one of the things that he said that really stuck with me was that what you do with your life should have some benefit for others. And I think that's something that was instilled in me very early on. And I think with every career move I have made and continue to make, I always think through, like, is it true to myself? Is it true to my beliefs? And then thinking through how it has that impact on others, which sometimes can be hard when you're in policy to see it all the way through, but to take a step back and think about that. The other one that is along the same line that really, really resonated was from Dr. Mike Diebold. And he told us that to whom much is given, much is required. And I think that really resonated with the Jesuit teaching as well of being men and women for others. I feel incredibly fortunate for all the opportunities that I've had. And I think one of the responsibilities that comes with that and is thinking about how you are helping others. So very similar of this idea of giving back to the communities of which you live in, like your local community, your global community. And so that's really been a driving piece for me. So I think those are the two in terms of North Star that I'll steal a little bit from them, but have resonated through the years.
And well, that sounds great. So I'm glad someone remembers quotes from our first semester of this
They're
class.
recorded.
So that's great. So let's open up the rest of the class. Other questions, folks? Don't be shy. There we go.
Hi, I really enjoyed hearing you talk about your work at CDC Washington, particularly the kind of back and forth between the health scientists and the government, and I think that is an emphasis. Like, well, I'm a global health major, and we definitely learn how to kind of talk about our field to other people. I'm also just very interested in global health and government, so I was kind of wondering, I don't know how much you can necessarily share, but if there's any specific story or challenge where it was kind of difficult to do that. It seems like sometimes, Congress people might not be the easiest audience to talk to about the work that CDC is doing, and how you overcame those problems, issues.
Yes. In terms of challenging content or just different viewpoints?
I guess either. I mean, it definitely could go either direction. Like if something was just so difficult to kind of distill, or perhaps when a congressperson disagreed with something that the CDC was doing, you had to explain your position or something like that.
Yeah, well, I think to the explaining your position, it's also not just your position, it's the position of the scientists. So it's talking with them and understanding what they're coming from, where they're coming, and then explaining it in a way that resonates. In terms of what might sound very dry, but I think is indicative of a lot, the not as cool on paper health topics, is I did a lot of work around data authority at CDC. So I don't know if you actually probably do know this because I made you read the webpage that we wrote. But there's no requirement in this country for states to report data to CDC. Now, the US government has an obligation under the IHR to report Ebola cases within 24 or 48 hours through the national focal point. But there's no requirement that if a state has an Ebola case, they send it to CDC. Now, most of them do because
it's the sensible thing to do.
But this was a real issue during COVID when you have a finite amount of defibrillator or whatever machine they needed, and you can only send it to so many states. And so, but you can't figure out which state has the biggest burden because they're all sending their data in different formats. So it's something that's not a fun topic. It's on paper, it's not oh great, CDC needs the authority to have data reported in a uniform way. But it was something that was so critical. So one of the things we spent a lot of time on is how do you talk about it in a way that's going to appeal to parties on both sides of the aisle. Right. And we never quite got there. I mean, legislation usually takes a couple of years, but a big thing that we did was thinking about how you're framing it. And one of the things that I thought was really innovative that we talked about is around substance use disorder data and the ability to have that so that you can see, like, if you're seeing a spike in overdoses in one state, like, how does that state next door know what to look out for, and how can CDC help that? And that was something that really resonated with folks. And I think that's just a good lesson in, you can almost always find an angle to something that everyone can agree on. You just have to spend the time to find it. And I think that was a really good example of how we did that.
And how, can I just follow up on that question? How much did you were working with the Hill and presumably with a lot of the same offices, even when you were covering different accounts. How much, when you look back, how much do you think your effectiveness was enhanced or not by the extent to which you built relationships with staff in those offices over time, or with members even in some cases? Because even if the topic changes.
I mean, I think that's the bread and butter of what working in Leg Affairs in DC is you don't want to be someone that just shows up with an ask and isn't going to be responsive. You want to be someone that people trust when they have a question, that you're going to get them an answer, you're going to get to them fairly rapidly, and that they can trust whatever you're saying. And you're not just putting a spin on it to put a spin on it, but you're looking at what they need and being responsive there. So relationships are a big part of the job, honestly. And relationships also can turn into friendships, and you figure out how to navigate those. But I think it definitely taking the time to understand where a staffer is coming from and also where their members coming from, so that if I'm changing a portfolio and I'm going to that staffer, I'm remembering, oh, their boss is really interested in this type of area. I think Senator Casey's a good one. He's really interested in child's health. So you can approach children's health from a lot of different angles. So if I was going to work with his office, how can I tie it into an issue area that they're interested in? So helping them help themselves and help their boss is another, and not always going with an ask. I think people will only sometimes reach out when they need something, and I think that's not a great practice.
Fair enough. No, I think that's a good practice for life. Other questions? So please.
I have like two questions.
Jessica, please.
One is a follow-up on your previous answer. I was wondering if there's the concern that the data could fall into the wrong hands, because data itself is like a tool, and of course, knowing the groups that we could help the most with these resources is so important, but also what if groups use it for the opposite reason? And then second question is slightly unrelated. I was wondering if in law school, you were able to develop a deeper understanding of health policy, or if somehow in law school there's a global health track, or if you could combine those somehow. Mm-hmm.
Those are both good questions. So on the data side, you hit the nail on the head with a lot of the pushback that we got from most stakeholders who weren't bought in yet. And that's where the details matter. So there is actually a lot of pre-existing legislation around data privacy. It's not the first time around the block that people have done things with data. So it was a two-pronged approach of, one, being able to explain to folks the data privacy provisions that already existed in the world and saying, this isn't the first time we're doing this. And then also making sure that we were being responsive and building in some additional privacy protection. So we were very intentional with how we worked and structured language to make sure that it addressed those concerns. And then when we were talking to staff, knowing whichever office was going to have a concern with that, bringing it up proactively instead of waiting to be asked for it. So not hiding the 8 ball there. Yeah. And then your second question was on...
at law school, whether you were able to focus on health policy or was more general.
Yes. So I was really fortunate. There's a wonderful institute which you ran.
At the beginning.
At the beginning, the O'Neill Institute at Georgetown, and they put on a number of incredible health classes. They used to do one where it was law students and undergrads and med students. I don't know if they still have it, but that was really great. Yep. And so I've had the chance to take a lot of classes through the O'Neill Institute, which has been really formative in terms of building out my concrete knowledge of even issues like TRIPS and intellectual property and global health, which is a very legal-y topic. I've also had the chance to take a lot of really great national security classes, which I don't necessarily know if that's where my career will go, but especially as I was covering the global health account, was really interesting to think through the global health components, the national security components. And I actually would say, I think it helped structure some of my messaging and work at the time for CDC we were doing a lot of work around PEPFAR funding, and not a novel topic to talk about global health as national security, but to explain how, and you all probably know, or someone's probably talked a lot about this, a lot of the global health funding is PEPFAR funding, and we're thinking about sustainable transition.
Well, not everyone here is in global health. I
Oh, sorry.
assume all the global health majors know this story, but you want to say a couple words about where most of our historically, where most of the U.S.'s global health funding has come from?
So traditionally, there was the big boom after the HIV/AIDS epidemic. President Bush helped spearhead a ton of investment in global HIV work through what's called PEPFAR. And it for years has been the backbone of most of the State Department's global health work, a good chunk of CDC's global health work as well, and a lot of what used to be USAID's global health work. So there's a very large ongoing debate right now about like the long-term future of the program, and this idea of you don't want to be funding countries indefinitely, and how do you talk about country ownership and sustainability of funding. But there's also the reality of we have entire country offices at CDC that are primarily, if not entirely, funded by PEPFAR funding. And there was a big gap left when USAID stopped their work, because it was not exactly 50-50, but there was a pretty decent split between CDC and USAID of who was executing the PEPFAR programs. And so one of the big things we were working on or had to do was explain that, yes, it's PEPFAR funding, but because we've been working with the country for decades, in some cases, on like building their HIV systems, building their data systems, creating relationships, that meant that the US was the first call when something else that wasn't HIV popped up, and what that meant for national security.
So
I think I lost the thread there a little bit.
Well, the thread I was going to bring you back to, no, I think that's useful for especially everyone here who's not studying global health. But I think the question that Jessica was asking is, how do you, law school, just quickly, the first year of law school, or if you're in the evening program, the first year and a half, is a set of courses that everyone has to take. Contracts, civil procedure, basics. But after that, and I think this is sometimes a surprise, law students have a tremendous amount of flexibility. So whether it's your last 2 years or your last 2.5 years, if you're in a 4-year evening program. So to answer your question in part, Jessica, is that I think, and I don't want to speak for you, but you had a chance, you had colleagues who probably took a lot of classes in corporate transactions and antitrust, because that was where their interest is. But you were able to take classes that had health and national security focus, which usually up to you.
Yeah.
At that, you get to decide what you use.
Yeah, you really scope it out, and you get to tailor it to exactly what, like I have friends that are more litigation focused, and they'll take litigation classes, and then like this semester I'm taking a healthcare fraud and abuse class and a like national security human rights class, and you're able to do both those things and tailor it. So it's interesting from that perspective.
Does that give?
It was a lot.
It's a lot, but I also think if any of you are thinking about law school, and I'm happy to talk to anyone. I don't persuade people to go to law school, just full disclosure. But if you do, some law schools have more offerings in the health law space than others. Georgetown does have probably the largest amount of health law offerings in the country, I think, at the moment, at least.
Yeah, for sure, and that's why I've been so excited to be able to continue my law career there.
So Other questions here in the room? Charles.
Oh, as a global health major, I have to say I'm a little jealous that you got to work at the CDC during a global pandemic. Could you talk a little bit more about like how that felt and what that was like?
Well, it felt like
That they were
very limited sleep.
Yeah.
You're really the first person that's talked about the global pandemic as something that you regretted in this, but I understand.
It's like
No,
the Super Bowl for
I,
public health.
no, I know how you feel. Dave.
Yeah. Well, I didn't sleep much for. Actually, I don't think I've slept much for the last 6 years. But I think, okay, twofold. A less serious, more like career-oriented thing, and I think I mentioned this earlier, is you just, everyone was underwater and trying to figure out, and it's interesting to talk about it now, because to put yourself back in that mental state is hard, but like, there was a lot of things no one knew what they were doing. There's a lot of things that you knew from other outbreaks that you're applying, but never quite at that scale. And the interesting thing for younger folks in your career is, like I mentioned, you were doing things that you would have never done otherwise, because the volume was astronomical. I think we did answer more congressional inquiries, hearings, letters in like a 6-month period than they had in years. So I think, like, from that standpoint, you're getting to build the ship and respond to it, and you're watching what other people are doing and seeing what you want to emulate in your career and what you are also seeing that folks aren't doing well, and then remembering those things and applying them. So I think it was a time of unique opportunity and innovation. Like, I think Operation Warp Speed, to give credit where credit is due. My dad worked on the HIV vaccine for years. I mean, they're still working on it, and they turned around the COVID vaccine in a matter of months. And I don't think we remember that enough, of the innovation that's possible when you are investing in public health. I think the other side of it is, and I think this is something that'll be true for you all too, is it's not just a light field to work in. The other quote that I wrote down was from Lois Pace, and she told, which I think she might have borrowed from someone, but one of the things she said, that statistics are stories with the tears wiped away. So I think that was another thing, is when you're working on the time, it's really easy to just get caught up in the churn. But to remember and one of the things I did very early in COVID was send out a newsletter every day with the number of cases and deaths. And to just take a moment to pause and say, you're doing this job, but there's real people that are being impacted in the world and that are going through this. And turning that into the driver, right? Of like, this is why we're doing the things that we're doing, because you want to help make the world a better place and help people live healthier lives. So I think and that's heavy. That's really heavy when you're young to think about. I mean, it's positive in that you can make a difference, but I do think it's also important to like be checking in with yourself and like acknowledging that, but then also processing it and moving forward.
I think all of you who serve, and I only, when the pandemic started, I was not in government, but I talked to a lot of people at all hours of the day and night. I mean, it was among the things that's most troubling to me about this last 12 months has been a failure to recognize how many people sacrificed around the clock to try to keep us safe. Now, making mistakes, for sure.
For sure.
But just the lack of appreciation for what Louisa and others did during that time, it's another one of the sort of the tragedies we're working through. But, we're going to get to the other side. But it was extraordinary. Great question. I was just joking. But please. Katie?
Thank you. You've worked at the CDC for like all sorts of situations. I was wondering, what one experience has most shaped your aspirations for health policy work, and like how did it manifest?
Ooh, that is a good one. I had a mentor at CDC who, when I started in the CDC Washington office, she was the only lawyer we had on staff, and I think one of the only lawyers they'd had for a while. And she was our oversight person. And at the very end of 2020, we were getting slammed with requests from the Hill, asking all sorts of questions of how decisions were being made. And a part of your job is you have to respond to congressional inquiries for information. And so I had the unique opportunity to work with her in the oversight space. And just the way that she was focused on telling the story and transparently and making sure that we weren't hiding things in the 8-ball really stuck with me of how do you, when you're working in healthcare and law and policy, like, yes, you're working with opinions that people have, but you have to keep it rooted in A, the science, and then B, the facts, and how do you build trust. And this was trust with the Hill, but then that translates, I think, to doing work in a way that is with integrity across the field. And I think that's something that I hope to continue to do in my career.
She was very impressive. You had a good mentor.
Yeah.
She was amazing. She is amazing. But other questions in the room? Oh, there we go.
I'm kind of just more interested in the connection between like your global health work and law, and I'm curious to know what you kind of see or hope to use your law degree for, and like how you're going to use that to influence global health or work with global health, or if there's something else that you kind of want to go towards, how you're going to keep those things connected.
So I think there's a lot of people that will, when you talk about global health law, they'll be like, oh, it's not a thing, and it's all fake, and those people are wrong. I mean, there's reasons behind it. But I think especially after COVID, and it's been challenging because I think we've lost the 8-ball a little bit on some of the changes that they were going to make, but the IHR is true. The international health regulations are one of the most like comprehensive and used global health law legal tools
In the world. Yeah.
in the world.
Yep.
And I mean, they are flawed, right? There's issues with them. But I think that there is this power when you have so many countries coalescing behind a set of principles. And I would like to see us get to a place where, and I think it'll take a while. I think there's some relationships that maybe need to be repaired before we would get here. But like, how do you find universal norms that are health grounded, but also legal grounded, that can protect the global community? And I think probably everyone ever has in global health has said diseases don't know borders, but that's really true when it comes to thinking about the legal space. I think sometimes we separate that, but you need laws and policies that can translate across those borders, because the diseases aren't going to stop. So I think that's one thing that I'm really interested in focusing on in the future, is how do you use that as a piece. And I think national security is maybe a unique way that there could be some more movement. And I know people have tried, and that's been some of the focus recently. But
Well, and I as hard as this moment is, I think it's going to be the global health lawyers of the future that are going to have to rebuild. I mean, a law just on a piece of paper is not, whether it's international law or domestic law, isn't self-executing, right? And we're not going to have a global police force, and even if we did, what exactly would they do? You know, what is important is to figure out processes and mechanisms where countries can cooperate more effectively. And I think the WHO, again, with the work with CDC, I mean, obviously it's not the case now, but I think actually the work that you're going to do with private sector entities who also have a stake, even if not all the governments of the world can agree, I think private organizations have an enormous stake in cooperation. I don't know if you feel that way.
Oh, I 100% feel that way. I do think, I'm never in your class, but I do think occasionally in my undergrad classes there could be a tendency to villainize the private sector, maybe to put it lightly, which I just think is such a missed opportunity of, like, new medicines don't just come out of nowhere. And I think if you're gonna move, like, driving an industry forward requires all the stakeholders in that industry to be moving in the same direction. And so I feel really strongly that if you can find effective ways to work with different sectors, you're gonna be more successful in the outcome. And you're gonna have more innovation. I know we talked about innovation a lot, but that is really how you get breakthroughs. I mean, I think that was one of the models of Operation Warp Speed, and one of the big successes of it is they were really bought in to how do you leverage that.
It's an incredible story. Please, as
Yeah,
well.
my question's like a little bit more general, but especially early in your career, how do you figure out when to say like yes or no to things? Like that's a very simplified way, but kind of when I'm thinking like time management priorities, like the decision to go to grad school while you're working, like taking on these opportunities, you're presented with like a wide breadth of things, or it sounds like you have been. How did you determine like what to say yes to and what to say no to?
So one of the other things that I wrote down, which I think we've almost checked off all of them now, was also from Dr. Dybel, and it was, if you are in 5 to 10 years where you expected to be, you did something wrong. And if you had asked me while I was sitting in this class that this would have been the career journey that I went on, I would have laughed. I had grand plans to go to the Hill after graduation, maybe spend some time there, maybe then go to an agency, and all of that was flipped upside down. And I think a big reason of that is that exact question of figuring out when to say yes. And I think it's really important to be open to opportunities that come. Now, within reason, right? You don't want to do something that doesn't make sense in your bigger picture, and you don't want to just say yes to everything. But I think being open to whatever comes can help you find a path that maybe you weren't expecting. And one of the big pieces of that is thinking through, like, are you gonna learn something? And I think that's another big driver of my career is I never want to stop learning. I think that's one of my life goals is I would love to continue learning. So when I was presented with different decisions, I would think about that, like, am I gonna learn something new here? And that helped guide me in what felt right along the way. And also choosing to work for really good people is another good advice I would give coming straight out.
Can I just follow up on that question on that last point? Because you have had some really terrific people who've been your mentors at work. And how did you, even when you weren't working for them, how did you stay in? It does seem a lot of you are going to be thinking about going into careers that I predict that you'll be in jobs that you didn't even know existed, because frankly, some of them probably don't exist now. But how did you stay in touch with your mentors even when you weren't working with them? Because it seemed like that's been key.
Yeah, and I highly recommend that. Now, I'm a big believer, I think DC has a lot to say about networking. I'm a big believer that quality is better than quantity. So I think for each thing that I did, instead of trying to stay in touch with 10 people, I had one person that I really connected with and that also really knew my work. Right. And I would focus on maintaining that with them in a way that felt organic too, because I think a lot of people will do this in a way that is disingenuous. So part of what that looks like for me is when I do have a big life decision, like checking in with them and seeing what they think, what their advice is. And part of that's networking, part of that's also because I really value their opinion and their thoughts. And you have provided a ton of advice to me over the years.
Easy in your case.
It's very kind. I think the other piece is it's okay to just send someone an update and say like, hey, just so you know, this is what I'm up to. Like, I hope you're doing well. I think there's also like always this sort of feeling of it has to be a conversation and you have to have a check-in. And a mentor along the way told me like, it's fine if you want to send me a note and just say like, here's what I'm up to. Like, hope you're doing great, so that I'm keeping track of you through the years. So then that's been the thing that I think has helped me do it a little bit more organically. Mm-hmm. And then just really making sure you're turning to them when you're making those decisions. And thinking about how you can be helpful to them as well. like from your different positions, I think is also important.
Oh, please.
As a previous pre-med student, what advice might you have for someone interested in that field but currently unsure about staying on that path in terms of how to find where your passion lies? And I guess what opportunities or experiences would you recommend someone seek to have an exposure to a variety of career paths when making those decisions?
So med school is a big time commitment and a big financial commitment to do if you're not sure. Now, that being said, I think the world needs more doctors and people that are passionate and ready to take on the work. Some of the things that helped me was getting different people's perspectives. I think having those conversations with folks that are in an area that you think you might want to work in is helpful to see, like, when they're actually talking about what they're doing in their day-to-day, does that sound interesting to you or not? I think another one, especially while you're at school, is there's so many opportunities available to you at Georgetown. So like one of the things I think I mentioned is I volunteered in the surgical waiting room, and that I think was a great way to see, like, do I like being in this physician environment? And the answer for me was, like, honestly, not really. Like, I wanted to be like debating with people and having conversations. So I think putting yourself in low stakes environments where you can start to test out what you like is a great way to do it. And so for me, that was this Hill internship that if you'd asked me when I came to law school, again, I think I was truly the only person who'd never taken a gov class in that internship. But going on a whim and trying it, like, will help you figure out what clicks or not. Yeah. And there's no wrong answer, too.
I'm just trying to see anybody else in here.
Got all the questions.
Well, we got a couple online, so why don't we open it up here?
All right, so this question is from Mark. Looking back at your time as an undergraduate student at Georgetown, is there an experience or opportunity you wish you had pursued?
Ooh, that's a good one. We did a decent. I almost wish. And this is probably going to be the opposite of what you're looking for. I almost wish I'd taken, and maybe this is also biased because I graduated in the middle of COVID. Like, I think I'd taken a little bit more time to just soak it in. It's such a unique time of your life to be with your friends. And one of my favorite parts about school is being in rooms with a bunch of people of different perspectives and getting to hear their experiences, what they think. And these are people that are going to go on, and you never know how they'll intersect later in your life. So I think it can feel very rushed and go, 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 but I think actually taking a moment to pause and enjoy it can make all the difference. Sorry, I know that's not a cop-out answer.
Actually, I think that's great advice. Johanna, anybody?
So we have another question from Eliza. In a time when global health faces significant challenges, what gives you hope?
That was going to be my last question, so you can jump ahead to it, and then I'll come up with another.
Okay. I think one of the things that gives me hope is actually, like, being here with you all right now. I think there's a lot of us that have been really, and I mentioned this, I'm really nervous about the next generation of public health professionals because they were the first ones to go in a lot of positions. And I think another thing people don't know is it's not just the federal government that's been impacted, it's all the contractors, all the nonprofit, like the scope of the spread, and even the privates. Like, I know there's certain companies that are private sector companies that have shed staff because they're young. And I think that is such a missed opportunity. So I think one of the things that gives me hope is you all sitting here and being excited about this work in this field, because we need it. And like, there could be another COVID around the corner, and you need people who have training and interest before then. I think the other thing is, like, this and this is going to be repetitive and sound a little cheesy, but this fundamental belief that in this field you really can make a difference for people. And I think one of the things that I always think about is, even if at some point in my life I just make a difference for one person, for me that's enough, because that is really the driver, and that's what gives me hope, is this recognition that this work really does matter, and it matters to people. And you might not always think about it all the way through, but I would encourage you to pause and think about how whatever you're doing does have that through line to an actual person, and that is what gives me hope.
Let me go. Oh, Jessica, I'm sorry.
The question that's been like sitting in my head.
Okay.
You're talking about international law like a while ago, and I was wondering if you have any thoughts on how, because I feel like you have to ideate about something before you like implement it, so you have a vision of how it should look like. So when thinking about international law, how do we avoid creating another like Western-centric international system like the United Nations or other like World Bank sort of Western-focused countries and truly make it international?
This is a really good question that I think a lot of the West is having to grapple with right now, and they haven't been able to just strong arm things through the UN like maybe they could in the past. The intellectual property space is, I think, on the forefronts of having to deal with this with access and benefit sharing for basically Western countries will want disease samples, but then sell back products like at extremely high rates. So that they've been, and I don't think they've solved it yet, figuring out how you take that balance of recognizing where samples are coming from. I think going back to my time at the World Health Organization, which I think where this came in very, very prevalently, is that we don't always just have the right answer. And automatically dismissing someone else's perspective just because they're from somewhere else is not the solution, and it's not going to get you far. So, and some people, I think, sometimes have some frustrations with Afro because I think they'll say it's a little crazy or like things move slower than in other places. And
I think that's fair.
I think that's fair and it's true, but I think there's also a reason for that, which is they take the time to think through the different perspectives and try to reach consensus where they can. And now, is that the perfect model? No, I think you probably need something in the middle, but I think it's the taking the time to do the due diligence to actually understand other people's perspective and take the time to think through, okay, maybe my position isn't just like automatically right. Theirs might not be automatically right either, but is there somewhere in the middle when it comes to a proposed law or a proposed policy? And then, or even if it's not something in the middle, is there a kernel of something in the middle that we can agree on? And then how do you build out from that? It's not perfect science. I don't think we've mastered it. I don't think we will for a bit, but I think that's where you start.
Well, I think it'll be interesting when you go to the law firm and you work representing private clients and a range of organizations, presumably, but this question of how do you balance, like, for example, intellectual property? Like, this is not a simple thing. You know, on the one hand, you want a multilateral, even a multi-stakeholder system that brings lots of perspectives to any given complicated issue. You also want Operation Warp Speed so that if you do have a pathogen that's new, you're not in a meeting 5 years later still trying to get consensus over how to move forward, right? And there's no simple answer to this, but to your point, I think we're at a moment where the understanding about how international law worked is going to be different than it's been. The last 80 years have been a different game than I think we are going forward. So what is that going to look like? I don't think anyone knows the answer, no. But I do think there'll be lawmaking in that space. So I think your intuition is right. Even if this may seem like a low point for international law, there's international problems still exist. So that's the future. It's exciting, though daunting.
Very daunting.
But any other online questions? But I will. Go ahead. We do?
We have another one.
Okay.
UNC or Duke?
This is a very important North Carolina question, and once you choose, you can't go back. And I chose when I was like 5, and I chose based on the colors. I'm a Tar Heel, born and bred. My mother's Tar Heel. My dad and brother are Duke fans, so house divided.
That's there are very few houses divided that I know about North Carolina. That's very interesting.
Yeah.
Now that may be the most illuminating part about your childhood. Can we switch back? I want to build a little bit off the law school question, because now you've gone from, we talked a lot about why you decided you wanted to go to law school, but now you're almost done. What's your take after 4 years of being in law school classes? Do you feel like it's worth it now? I know you kind of have to because you have to pay off your loans, but I guess I'd love your thoughts on where was it worth it? Was it what you expected? Is it something different?
I think it has 100% been worth it for me. I do think if anyone's considering it, you should make sure you don't need to know exactly what you're gonna do afterward, but you should have an idea of a couple things that you'd be excited about. I think it has been worth it for me, but not maybe just for the like going to school and learning the things. I think actually a lot of people say this about law school. It's not really about the like concrete facts that you learn. It's a way of seeing the world. And it's a way of understanding the law is not a fixed thing. It's this living, breathing entity. And so for me, what's been worth it is learning how do you work with that? How do you adapt to that? How do you look for opportunities within that? And then another big piece for me has been the people I've met along the way, from professors to students, and how they're going to factor in through the things that I've learned from them throughout the rest of my career. So I've really enjoyed it. It has been by far the hardest 4 years of my life. I think when I started, it was still the end of COVID, and then I've worked some crazy jobs and then, but I don't think I would take back a minute of it, because I think each decision I've made in my life along the way, I didn't know it at the time, but it has led me to where I am. Like if you had told me that internship I did my junior year of college would be the reason I got to go into the UN General Assembly meeting or have this job now, I would have like laughed. But it's all threads that make you who you are in this moment.
So we've talked a bit about what life's like working inside a government, because you've spent a lot of your time inside. But you've spent a little bit of time this last year working outside from an advocacy perspective. My guess is that some of you probably may not be thinking immediately of going into government and may not be thinking about immediately going to law school, but you might think about working with or for an organization that is interested in advancing research or just promoting public health measures that can deal with individual diseases. So maybe if you could tell us a little bit about what it feels like to be on the outside now, so to speak, working for the Parkinson's Foundation, like what you do and to what extent the skills you've learned inside are relevant, or the skills you've learned in law school so far are relevant.
It has been such an incredible experience. I think I'm really grateful that I get to see health policy from so many different perspectives. And some of the skills I carried through, like there is a piece of it that is ledge focused. So that's a lot of the transferable skills from the Washington office. I think one of the pieces that has been really interesting to see is this idea around coalition building and how you can use many voices to lift up a message. And especially right now, I don't think I've ever seen organizations work. Like, I think you would be a little nervous they'd be at each other's throats over appropriate government funding and trying to like get their disease money. But I think there's been this recognition of working together to lift up the need for sustained federal investments, especially in cures. That has been really powerful to see, that I don't think I always appreciated from the government side, because I think it's usually more targeted at the Hill than at agencies. But this thinking through how you use so many different levers at once with your different voices has been really, really powerful. And I think that's one of the things as we're building up the policy work at the Parkinson's Foundation is how do we like harness that? And people are excited to get involved. And so how do you harness that excitement to have real change and like changes that are going to resonate with policymakers?
So when people come to your website and they see the policy agenda you helped draft, and they click, if you go to the bottom of there's like, how can I get involved?
Yes.
What do people do? What do you channel? Because people, if they click, they'll want to do something. And how do you help them advocate?
So we're still in some ways building the ship while we're flying it, because the foundation had not really done almost anything policy related before Andy came in and built up the team. There's a couple ways that we really encourage people to get involved. And first is to reach out to their member of Congress or their local legislator. And I think this is a thing that not everyone knows is just a thing you can do to write a message and say like, hey, this is something I really care about and this is what I would like you, my elected representative, to do about it. So there's a piece of it that's that of like helping people coalesce around certain messages of like changes to push. Another one of it that's really exciting and for me is we're working on a policy forum where we're going to bring hundreds of advocates to DC in March and help them go to the Hill and talk about their own personal experience with Parkinson's disease. And that I think helps staffers and members do that thing that I was talking to you about, okay, we're just talking about on paper this change, but what does that change mean for a real person who is living with a condition, and how is it going to have a real world impact on them that's for the better? And so I love that, bringing folks and looking at how you can bring folks to the Hill to do that. So I think those are two examples in many ways.
Excellent. So if not, if any other questions? Otherwise, I've had to make up my new final question since the...
Swooped.
So if you could transport yourself back to being in this class almost 7 years ago now, I think, right? Something like that. Mm-hmm. What would you say to now that you've had this experience, what would you say to your younger self as you look ahead? Because my sense, everybody here, you might imagine, is trying to figure out where they're going to go, what they're going to do. There's lots of things. The world's a pretty tumultuous place. So any message that you'd give to your younger self?
Yeah, so many. My younger self was a mess. But I think the biggest one is that it's gonna be okay, right? Like, I know it doesn't feel that way sometimes and right now, but if you stay true to who you are, what you're interested in, what you're passionate about, and shape your life around those principles, it might take a minute. There might be speed bumps. I've had plenty of speed bumps and failures over the years. But that's okay, and you learn from those too. And so it's okay not to have something figured out right away. It's okay to change your mind. It really sucks that the world's the way it is sometimes, and like we should do something about that, but it is also going to be okay. Like there's always going to be an after. And so I think with that, and going back to the advice that someone asked about what you've done at Georgetown, like live in the moment, enjoy this time. You're never gonna have this time again. And whatever comes next, it's gonna lead you to the next thing and the next thing. And it might not make sense in the moment, or you might not be thrilled about it when it happens, but that doesn't mean it's not where you're supposed to be.
That seems like a perfect place to end. So could you join me in a round of applause for our guests? Lisa, thank you for doing this.